Okay. Is station 3 is about advocacy. And the question reads this: there is a rise in the incidence of chronic hepatitis B and its complications in the community. Question number 1, how will you address the situation? 2, how will you convince the government to intervene? 3, what groups of people will you like to partner with? So looking at the question, it's more of and trying to see an advocacy form of question. So I'll answer my question by number 1, how will you address the situation? By doing advocacy. And what is this advocacy? Advocacy is a set of specific actions that are directed at changing policies or programs of a particular issue. It's very, very important in that it enables people to have a voice in decisions that affect their day-to-day lives and health. And it also helps the government to be accountable for meeting the health needs of the entire population. So I will follow my advocacy by following a particular acronym, the famous acronym PACOP. P for prepare and plan, A for alliance, R for resources, C for campaign, O for organization. Prepare and plan. This is one of the important, the first step to follow. And it has about 5 components. And all those 5 components must be done very well. The first thing I will do is I will set up a team. We all know that a team is a group of people with complementary skills, function, knowledge, and expertise that agree to work together towards a common goal. So this team will comprise of a lot of individual stakeholders that will contribute in this advocacy. You all believe with me, having a chief medical director, CMAC, in this may provide some security, some resources, as well as institutional advice to this. So again, I would like to involve the physicians that are more close to this kind of patient that take care of them, like gastroenterologists, ID physicians, as well as some of the other health workers that took part in the care of this patient, like the nurses, pharmacists, secretary, hospital directors, and media. Media is very, very important. It's one of the skills that is tested for somebody to have a very, if you have a, if you know, it's one of the skills tested for somebody to have a proper advocacy. You have to have ability to strategic use of media is very important. It's one of the tested quality for somebody with a very good, that can do a very good advocacy. So this is my team. It involves these stakeholders of CMD, CMAC, and all those mentioned above. But media is very, very important in this. Then I will clearly define the problem. This problem will be clearly defined as well as being communicated to all the members of the team. All team members must be aware of this problem. What is this problem? Rising incidence of hepatitis B. Define my problem clearly. I also clearly define, and the objective of this advocacy should be something tailored towards solving the identified problem. So my objective here is to increase awareness and knowledge of the risk factors, route of transmission, symptoms, and complications of hepatitis B infection. So this should be my objective. And again, sometimes it's better to have a theme or motto for an advocacy. So this should also be my theme for that. Increase awareness and knowledge of risk factors, route of transmission, symptoms, and complication of that. So having done that, I have to identify my target population. This my target population could be a country, could be a state, could be a local government, could be some ward within a local government, could be an area where this rising incidence of Hep B is being identified. And the next thing again, I have to test the knowledge, the background knowledge of this community, because it helps me to establish a knowledge gap to plan very well. If they are well knowledgeable about the disease, I should know what I'll add to them more. And if they don't have much knowledge, again, it should help me to plan. So I'll design a questionnaire to obtain information on what knowledge they have, so that I can identify the knowledge gaps and how to address that. So and their knowledge on this rising incidence of hepatitis B depends on their background education level, depends on their socioeconomic status, because if they have a low social, they cannot go to the hospital and they cannot afford some cares, they cannot watch even some programs allocated for this disease. So this is my prepare and plan. I'll follow these 5 steps. Let me repeat again. I say I will set a team. I'll clearly define the problem. I will set an objective which I should communicate to all team members, and also identify my target population. Then I will design a questionnaire to address the background knowledge of hepatitis B and its complication in a particular community, as well as their thinking towards hepatitis B and some of their practices that could aid in transmission of that. Because in designing the knowledge graphs, these are the things I should be looking for to improve upon. So moving to the next is alliance. So having the first part of the advocacy, then I need to form an alliance. Having my team, having the knowledge of the community, then I have to form alliance. I cannot just go to the community to start my advocacy, meaning the stakeholders, the chairman, or the governor, as the case may be, the community leaders, the youth leaders in that environment, the women leaders, all those will contribute a lot in educating and mobilizing and some other supports that I needed to execute my, without which I cannot do that successfully in that community. So these are the alliance. I have to form a very good alliance with this kind of people that will help in that. Then the next thing is the resources. Having my team, having identified my problem, having set an objective, having identifying my community, having set identified the knowledge gaps in the community, forming alliance with that. Without resources, this cannot be happened, because this is a capitally intensive project. So I have to seek for resources. These resources usually from the government or non-governmental organization. It could be from some individuals with an interest in what I'm advocating of. That's a rising incidence of hepatitis B and its complications. So again, whenever I got these resources, and the resources could be financial, could be machine, could be materials, could be all sorts of resources needed to execute that. Then I will ensure transparency of resource management from the government, because advocacy is not just a single thing. It requires, you may need to go back several times. So again, if I have a very good transparency of how the resources are being shared, it opens the door for subsequent allocation, subsequent contribution by this kind of body. So meaning I should have a secretary, financial director, and everything involved, and it should be transparent and it should be well written and reach out as it should be. Then the campaign proper. So all those steps that we took were the steps before the main campaign. So the main campaign, I have to have my activities, I have to write design of my activities clearly. And again, roles must be assigned to all the individuals as they should be. I should have records of people, the record number of people, their age, and what health talk we're giving to them. If some screening has been carried out on them, like maybe screening for hepatitis B, I have to have that. Then I have to allocate some rules that some of the members that will handle the media, and again, some of the people that will also discuss with the community leaders, some of the people that will have the banners, the flyers sharing to this kind of people. So all the responsibilities must be assigned. Any responsibility not assigned is considered not done, because in a team, it has to be clearly defined that this is everybody's role, so that if something goes wrong, you have someone to take responsible for. So again, going to the community proper, then for advocacy, I may display banners, as I said, pictures of indicating risk factors, like maybe some indiscriminate use of sharps, improper transfusion of blood, and babies that are not immunized appropriately, and some other things that will attract people's attention towards that. And again, jaundice and ascites, pictures of patients indicating these are the possible complications that could come from this. Then health talk to the community. This should be in a simple and straightforward, and in a language they understand better. So meaning my team should compose of a lot of people. If they cannot understand English very well, we should find among my team people that can speak the language they understand, because the essence is to communicate of my ideas. So I would just like to say one or two things I would like to tell them. Like, this is my theme is rising incidence. There is a rising incidence of hepatitis B and its complications. So I will educate them that in a very simple way that, okay, hepatitis is an infection caused by a virus. And this virus has more, he likes to go to the liver. And there are 5 of them, of which A, B, C, D, E, and B and C are the most severe one that can lead to damage to the liver. If somebody come in contact with this, he can have symptoms or he may not have a symptom. Some of those symptoms could be feeling unwell, fever, weight loss, loss of taste. But if it progresses, yellowness of the eyes, and if it damages the liver, fluid may accumulate in the abdomen, and some other things related to that. And also like to tell them about the routes of transmission, like improper use of sharps, or improper transfusion of blood, on-screen blood, or a mother that has the disease giving birth to a baby, there is high chance of that baby, and non-completion of immunization or improper or poor immunization uptake. So these are some of the things I'll educate them. I also like to know in the community, what are those their cultural practices that aid in transmission of that, and address that. Like one of the community, I used to know one of the community where 10, 15, 20 children are being gathered and have a traditional circumcision by single knife or something of that. So you see, that has been one of the mode of transmission of this disease. Or in a house, people are using just single razor blades to cut their fingers or some other things. And some people that shared needles. So I would like to dig to what were their cultural practices that could be directly or indirectly related to transmission of this disease. Okay. The next thing is organization. For the organization, we need to create some new organization, or strengthen or modify the existing ones, and strengthen industrial capacity. Going to the one of the most important one is monitoring and evaluation. This is a very important. This after the main advocacy. So we need to really monitor. How do we do that? We have to evaluate. Okay, what have we done to this community regarding the knowledge gaps that we said we are going to create? Then, what change in knowledge gap have occurred? Did you really understood what we said? And does it translate to their practices? Does it translate to the maybe reduction in the incidence of this disease? Then what is the objective improvement in the knowledge gaps we achieved? And sometimes we may give a time frame to allow for this change. And after which advocacy may be repeated if there is. So if you assess that you really meet up all the objectives, you may need to repeat. However, in some cases, you may find that you did not achieve the target. So you may need to go back and repeat advocacy. As advocacy is not just a single thing, it's not by only single person, it's a teamwork. So like a clinical audit is a continuous process. So going for question number 2, how will you convince the government to intervene? So having done an advocacy, it armed me with a lot of knowledge and facts about this disease. So I can present my fact to the government that, okay, actually there is a high burden of this disease in the community. If I have a figure I can display, then there is a poor knowledge among people in the community of the risk factors, route of transmission of disease. If there are some of the cultural practices that aid in that, I will highlight that. Then the morbidity and mortality associated with the disease, and we all know chronic hepatitis B progressing to chronic liver disease, the morbidity and mortality is very high. And in this our environment, we don't do other supportive cares and definitive treatment like liver transplant. So morbidity and mortality is actually very high. So I have to display this to the government, hoping to convince them with facts. And if I have some other data around, I can present that. So what group of people will you like to partner with? I would like to partner with anybody interested and the stakeholders that will make the progress of this advocacy, like even the president, the ministers, the House of Assembly, the senators, all those, the lawmakers, then the community leaders, youth leaders, women leaders, media. Media is very, very important. Handling media is one of the skills, as we said, that is needed for somebody to have a very good advocacy. Doctors, nurses, pharmacists, lab scientists, radiologists, and the list is not exhaustive. So I have just few maybe five, 6 slides, just small slides about advocacy. Advocacy is a set of specific actions directed at changing policies or programs for the particular issue. It plays a key role in building strong health systems and enable people have a voice in decisions that affect their day-to-day lives and health. It helps hold government accountable for meeting the health needs of the entire population. These are some of the levels of advocacy. It could be patient level, practice level, but this practice level looks like a clinical audit, if I'm not wrong. Then the community, like the one we just do is for community. So it could be at the level of patient at practice. And so there are types of advocacy, which I group into advocacy 1 and advocacy 2. Advocacy 1 is self, as the name implies, self-advocacy. Someone effectively communicating his interests, desires, and need and rights. So it's like form of the self. Then patient advocacy. This is where an individual or a group of people, organization, representing some group of people, advocating for their illnesses, their rights, and other things. It could be a group, like our index question. It could be a group of people with chronic hepatitis B coming together, informing themselves and sharing experiences and looking for way forward. So they are a form of group advocate. It could be a peer-to-peer, meaning an individual and an individual with a particular thing joining together, like in this case, hepatitis B or chronic liver disease coming together individually. Individual meeting another person, telling him more about advocating 1 or 2 ways to do better and that. So it could also be types, there could be types, advocacy 2 types. So these are the citizen advocacy, statutory, non-instructed, legal, and professional advocacy. So what are the target of health advocacy? Time is not on our side. Policies and practices of government and institutions. We target this advocacy in order for the government to make them into policies and practices. Like for this one, particular increase incidence of, if the government will say, make a law that every child born in that area must have vaccine, hepatitis B vaccine, that will help a lot. And again, the government must provide infrastructures and resources for that, not just making a law. So that is one of the target of that, for an action by the lawmakers. So government laws and regulations. And then the commercial marketing process of industries, they can also help in advertising and doing other things like activities of counter health lobbying groups also is important. So what are the skills needed for a proper advocacy? As we said, ability to work collaboratively with multiple stakeholders. This is very, very important. Is an activity that goes with time, how to collaborate with them. You know, you could imagine meeting with the state governor, with ministers and other high-ranking people. So your ability is to collaborate with them is also important. Then strategic use of social media. Social media will help a lot because within 1 second, 1 minute, they can advertise, they can disseminate what we are doing so that other people in other places with the same disease or without disease will be aware of what is going on. And they can also share their experiences and knowledge with other people. So media is very important. Ability to conduct strategic analysis. You have to analyze what has been done, what is going to be done, and what has been done. This can be done by 3 central questions. What is the problem? As we said, the problem is rising incidence of hepatitis B and its complication. And what is the desired solution? We want to improve the knowledge of that community about the hepatitis B, its risk factors, mode of transmission, prevention. So who are the target for the change? Again, we have to be very specific and know, okay, these are the kind of people that we target for that advocacy. Then what are the audiences for advocacy interventions? This could be divided into 3 groups. The primary target are the people, organizations with the power to take desired changes. Like, okay, we target the government to be aware, the stakeholders, the lawmakers. So like the ministers of health, state governors, we can categorize them as primary target for that because they have all the capacity to make laws and policies. So the secondary target is a group composed of individual group who can mobilize, like the CMDs, the head of some institutions. In that case, they are the secondary target. They can also have a role. They can link our advocacy to the ministers, to the lawmakers. Then the tertiary target group, which is general population, which we're advocating for. So these are my references for specialty update discussion with some of the teachers in this group. So thank you very much. As we said, is not something we do routinely. We are looking forward to learn more about that. I'm happy that my teachers and my colleagues are there. So contributions are highly welcome. Thank you very much.
Thank you. Thank you, Dr. Yahya, for the wonderful presentation. It's a nice one. So colleagues, let's interact and let's have discussion about the presentation. Okay. I can't see anybody's hands.
Dr. Tanimu is raising his hand.
Okay, Dr. Tanimu, please go ahead.
Thank you very much, Dr. Yahya, for this very good presentation. Well, the issue is advocacy. The main active words there are advocacy and community. Community, you have to define what is community. Community, you can define it as a group of people sharing a common characteristics, either by geography or by goal. And also you have to, if you are dealing with hospital, that is when you involve CMD, you involve this. But community may not be only hospital. It can be local government, it can be a ward, it can be this, it can be anything. So that is it. Another issue is this type of question doesn't have any specific formality. You have to manipulate and answer it, in the sense that if you come, you have to define what is the rising incidence in the community. What is the rising incidence? You have to define what was the previous incidence and what is the current incidence and what are the complications. So if you don't know the previous incidence of the hepatitis in the community, so how will you monitor? You cannot monitor. So that is it. So you have to define the previous incidence of the disease and the type of the hepatitis they have, the incidence of the various types, if any, and the rising incidence that they want you to address by advocacy. So by and large, as that will help you to have to monitor if your advocacy is effective or is giving improvement. There is improvement after the advocacy. Then you monitor where is the incidence rising, and also for hepatitis, you have to say the commonest mode of transmission is, especially in the local community, is via sexual intercourse. So you have to raise that one.
No, I disagree with that, please. Is contact with blood, not sexual transmission, please.
Okay, sir. Thank you very much, sir.
Thank you.
Thank you, Dr. Tanimu, for all the corrections. The hepatitis has already said is B, so it's directed is B. Okay, but thank you for all the corrections. Thank you.
Okay,
and
thank you very much.
I'm happy our teachers are in the group so they can help more, because we are just learning these things.
So that is very good, but you have done very well. For this, our group is for correction, for so that we make good make changes in, because we are all learning. Thank you very much. But it's a very good one. Thank you very much.
Okay, thank you, Dr. Tanimu, for the comments. Any more comments, please, colleagues? Hello, colleagues. Can we make comments with regard to the discussion, the presentation?
I have a question, please.
Okay, go ahead.
Please, I don't know whether one of my teacher will shed more light on that organization. I try to understand it. That's why I skipped it. I quickly skipped that on organization after the alliance, after the conduction of the campaign, this organization, I don't know.
Okay.
Thank you.
Okay, I think they will make comment at the end of all our discussion.
Yes.
Okay. Yes. Sorry, my comment, Dr. Yahya. Thank you very much for the presentation. You did very well, but I think it's better you simulate the exam situation because the way you discuss it as if you are teaching somebody. So it's better always when question like this come, approach it as if you are seeing the examiner asking you this particular question. This is what I will do. I will identify the for the preparation. I will make this preparation. I will do this. I will do that. I will do this. I will do that. Then for the alliance, I will make alliance with the particular group of individuals, the gatekeepers, the community leaders. I will identify people that are conversant with social media, both written, both printed media and the old social older medias, and then the new social media that we have in term the Facebook, WhatsApp pages, YouTube, and the likes. So I'll make this. Then for the organization, I will do this, I will do that. So it should be an active, it sounds actively you are doing it. I think that's the best way to approach the question. But by and large, I think you covered most of the things that are supposed to be covered. And then the only individual that you forget to mention in your presentation are the people that are suffering with the disease. Those
Yes.
individuals that are survivors of hepatitis B infection, or individuals that have family members who are affected by hepatitis B. For instance, somebody have a husband and the husband died of hepatitis B, or somebody is having a father and he's still actively taking care of the father, the way he's suffering, going to the hospital, having some cases of probably encephalopathy and stuff like that, or somebody that have been spending on some of his children or some of his boys. Maybe somebody is working with him and the staff now got infected with hepatitis B, and now his performance in the company is so limited, and at the end of the day the company is spending a lot. So carry these people along in the course of your presentation. But I think it's a very good presentation. Thank
Thank
you.
you, sir. It's noted. As I said, it's one of the area that actually I will constantly lead the guidance of our teachers, because we are just starting that. But thank you very much for that. I will incorporate that subsequently. Thank you very much, sir.
Okay, thank you, teachers. Can you make comments on this before we move to the next presentation?
Okay. Hello, Dr. Dahatu. Can I be heard?
Yes, ma. You can go ahead.
I
Ma.
must remind Dr. Yahaya. Dr. Yahaya did so well. No, you did well, though. No, jokes apart, you did well. If you talk like this in exam, truth of the matter is you've passed the station, you did well. I just want to make some comment then, and our other facilitators will come in. In your alliance, I don't know if I heard Dr. Animu clearly. Irrespective of where you're doing the advocacy, the hospital CMDs will always come in, because this is something that is health related. So the hospital CMDs will always come in. It depends on the local government you're doing. If there are like 4 hospitals there, all the CMDs will be involved. One other person you missed in your team forming, remember, this is advocacy. You need a secretary, somebody that you guys will be having meetings, somebody that will be taking down notes during the meeting. So you need a secretary. Then also you need when you're done with all of this, these things will be spread via social media jingles. So you need a social media coordinator. Then you also need someone, if I heard clearly, somebody in the finance department, maybe the government arm, somebody in the finance, in the hospital, and the government, local government, and a representative of the state or local government treasury. Because these things, they're going to be sponsored. They're not going to come from you. They're going to be sponsored. So if it's you, everything's coming from your pocket, you might not be able to do a good job. So you need sponsor from the government. So those guys, the government and treasury, they have to be there. Then I think there was one I wanted to say, I missed it. If I remember it, I will say it too. Then also for organization, organization is like you've formed your team, you form your alliance. No alliance is like the gatekeepers, the kings, the women leader, men leader, youth leader, market leader, church leaders, mosque leaders, imam rather, all the gatekeepers, those will be your alliance. Those will be alliance. Then organization, when you are dealing with organization, you're going to put different people into different groups. Okay, you are in charge of social media, this group of persons. You're going to give people specific tasks because there will be a team, but there will be a sub-team and sub-teams. So you're going to be organizing people based on their specialties into different organizations and giving them specific tasks, specific roles. So there'll be different organizations. So you're going to organize people into specific subgroups with specific roles, and they'll have people they'll be reporting to. Not everybody, not one person, everybody can be reporting to the person in charge. So different heads, so there'll be subheads, and each of these subheads will report to the overall coordinator. So organization is just putting people into, organizing them into specific groups. You 5 people, so you're in charge of social media, so you're in charge of welfare. People will be, you guys, when you guys are meeting, they'll be sharing of snacks, drinks and the rest. So welfare is also important. And also some of these advocacy, one or two things to encourage those people that are suffering, all of that. You're going to produce pamphlets. That's why I said the financial arm of the government have to be involved. We have a lot of pamphlets. They're going to be sharing pamphlets. You're going to involve the media, radio, and the rest of that money. So you have these people. So you have different organizations. So organization, you are putting people into specific roles where there will be sub-heads that will be reporting to the overall coordinator. I don't know if any other person want to add anything. Dr. Yahaya, hope is clear.
Yes, ma, it's clear, ma. Thank you very much for that, ma.
I don't know if our teachers, Chief Cookie, Chief Chitu, they have any comments. Dr. Fatima just came from the exam. Your head is still fresh. Any comments?
Yeah, well done, Dr. Haya. Thank you very much, Christabel, for that excellent comment. I think most of it has been said. However, regarding what Dr. Tanimu said, that you have to check out for the knowledge gaps, the rising incidents. I think on that prepare and plan, Dr. Haya was made a comment that he will prepare a questionnaire trying to involve the patient relatives. So at that point, he will try to ask a lot of questions that will address his problem, and which will help him establish the knowledge gap and take the appropriate step forward. I think that has been well said. However, Dr. Haya and other colleagues, you should know that the exams now is applied. No one will ask you, give me the steps. What are the steps in advocacy? No, they'll just give you a scenario and say, just paint a question that will tilt you to understanding that you are supposed to advocate on this problem. So in our exams, we are asked to advocate on the common community, on the common problem in our local community, which for me, I thought of leprosy, and they said, so how will you address the problem? So you will just rattle. So it's very important to have the steps at your fingertips so that you just rattle them. They will not be expecting to start saying, there are so many steps. No, just apply the knowledge and flow. That's it. So biology is a very nice one. Well done.
Thank you, ma. Thank you very much for all the support.
Thank you, ma. Sorry, facilitators, allow me to read comment from the chat box. Dr. Anthony is actually thanking Dr. Yahaya. Then Dr. Adebayo say a non-organization advocating for hepatitis B, also a known and influential person in the community is important. So you should try and know those NGOs that are advocating for hepatitis B, like at the level of the Federal Ministry of Health, we have the National Hepatitis Control Program. Then Dr. Ijeoma said, good morning, my teachers. Thank you, Dr. Ha. Please, I would like to know if the team is too long. Then Dr. Precious said a SWOT analysis can be done for organization, the strength, the staff skills. You are linked to government, purpose, and political credibility. Also for the strength, the weakness, internal problem, limited community support, etc. Then for the opportunities, new policies, initiatives, international conferences, and then for the threats, lack of coordination, cultural views, and etc. Thank you. Sorry, Dr. Can you respond to one of the questions?
Okay, somebody said the theme.
Yes, the theme.
The
I
theme.
don't know if the theme is too long.
Okay, is it the theme or the theme? Which one did she mean?
Theme.
Okay, as I said, my objective is increasing awareness and knowledge of the risk factors, the route of dissemination, symptoms, and complications. And as our teachers advised us during the previous one, that it's better to have a theme for that will carry like our motto logo for this. So I said the objective should be like our theme now. So our theme is this increase in awareness and knowledge of risk factors, symptoms, and complication of hepatitis B infection. But I don't know what she means by.
That's too long.
Okay,
Sorry,
ma'am. Okay, ma'am.
I'm driving,
Okay,
so I
ma'am.
can't read my hand.
Yes,
That's
ma'am.
too long.
Okay, ma'am.
When we talk about when we celebrate World Hepatitis Day, we have a catchy phrase. Like the major theme is to eliminate hepatitis come 2030. So one of the major themes is to find the missing millions.
Okay.
So because the disease is largely transmitted, asymptomatically. So a lot of people do not know that they have hepatitis B infection, and they go around infecting other people. So it's to find out those who are infected and then link them up to care. And then those who are not infected, you link them up to vaccination. So in each year we have our different sub teams. So there was a year we looked at preventing mother-to-child transmission, because that's one of the major means of transmission. Sexual hepatitis B is sexually transmitted, but that is not a top mode of transmission. That's why you can agree with me that you see a lot of discordant couple. So many. You will see a husband, they've been married for years, he's positive, the wife is negative, and vice versa. Only that person in the family. And that's because the common means of transmission is through contact with contaminated blood and body fluids. So it's blood that is sharing of sharps. So when you are talking in a community, that's actually what you should be advocating for. So communities that have poor sharps practices, like circumcision, where they use the same instrument to circumcise everybody, both female genital mutilation and male circumcision. So that's one area that you can look at, or prevention of mother-to-child transmission. So to ensure that all pregnant women are screened. And then if they are found to have hepatitis B infection, the babies are vaccinated at birth with the hepatitis B immunoglobulin, as well as the hepatitis B vaccine. So those are the things. Then, like last year, our team was one liver, one life. So these are catchy things. So this long thing you described, I think it sounds more like your different objectives, because part of our different objectives is, one, we can't wait. That's another thing. We can't wait to eliminate hepatitis B from our communities. So we can't wait to link pregnant women to care. We can't wait to set up vaccination centers, immunization centers to vaccinate people against hepatitis B. We can't wait to end discrimination against people living with hepatitis B, because that's another angle to also look at it too, because people won't want to come forward, so that they don't want other people to know that they have it and then discriminate against them. So these are the things in advocacy. So if what I just said is that if you look at what we do when we celebrate World Health Days. That is purely advocacy. Then even when you're talking with the media, you also engage important personalities. So I know that there's one I usually see on channels when they are talking about wildlife, extermination of wildlife, and they have different football players who come to talk about, oh, don't kill lions, don't kill elephants. You know, these are our they are part of our habitat and all that. So that's a form of advocacy. So you can get Davido, you can get, you know, Tiwa Savage, any of these musicians to be parts of your advocacy. So when people see them talking about, oh, everybody should know their status, go and vaccinate, you know, if you are negative, you know, so that would get people to be aware of it, and then, you know, get campaigns, religious, these things, so that even in churches and markets, these are areas that you go to sensitize the people, and then do outreach. So the people, because of course you will need money for this, so that's why the legislature is part of in advocacy, because these are the people who would so you can partner with them, you know, because each in the legislation they are giving money for constituency projects. So discussing things like this to them, advocacy is usually what is the basis of their constituency projects. So they can key into this plan you have, you know, and support you financially, and then also attract the things you will need, you know. So if that place does not have you know, centers where people can be screened, even to get the kits for screening, they are the ones that will buy it and donate it free, and make those things free, and even the vaccines, get it free for the community. So that's why the legislators are highly needed in any advocacy program. Then of course you also have to monitor to ensure that when you've put these things in place, so it's not a one-off thing. So it's like the clinical audit, that is an improvement cycle. So you need to be monitoring to ensure that, you know, things are being carried out, and then encouraging them. So that's my own addition. Thank you.
Thank you, Ma.
Thank you very much, ma'am.
Sorry, Dr. How can you share so that the next presenter, I don't know if, so facilitators, can we take another presentation?
Yes, please.
Okay. The next person, please, can you share your screen while we're awaiting more comment from our facilitators? Chief Shitu, I don't know, he used to give us a good. Okay. Other facilitators, sir? Okay, I think the next presenter can go ahead to start his or her presentation. Okay, Dr. Temitope.
Okay. Good morning, teachers, senior colleagues, and colleagues present. I'll be taking the May 2022 practice question number 4. My name is Dr. Temitope Fakunda. Okay, so the question is, you were called to review a 28-year-old woman in first trimester who had a missed abortion and was evacuated. She later developed fever, bleeding per vagina. Then the pulse rate was 130 beats per minute. The respiratory rate was 40 cycles per minute. The temperature was 38 degrees. Then lab tests provided include hemoglobin of 7, platelets of 90, white blood cell count of 4.56 with relative lymphocytosis, and deranged EUCR. So the first question is, what is your diagnosis? So my diagnosis is severe sepsis, post-abortal sepsis, complicated with severe anemia and acute kidney injury. And this is based on the presentation. she had a recent instrumentation for a missed abortion, and then septic abortion is considered in any woman that has a temperature of 38 degrees or more following an abortion, and usually presents with fever, abdominal pain, and vaginal bleeding, so which is in keeping with the clinical details provided. So going forward, making an assessment of sepsis. So I'm going to use the SIRS criteria. So from the information provided, once you have 2 or more of these SIRS criteria with a presence of a confirmed or a suspected infection, then we can make the diagnosis of sepsis. So the patient has a heart rate of more than 90 beats per minute. She has a respiratory rate of more than 20 beats per minute. And then with the history of recent instrumentation for the evacuation. So that is how I arrived at my diagnosis. And then I said severe sepsis because some of the other parameters that were provided, so her platelet count was reduced, and she had a respiratory rate of 40 cycles per minute, which could suggest some form of acute lung injury. And then we were told that her EUCR was deranged. So the second question is to list the differentials and as many as possible. Okay, so because of time, I won't go through everything, but just to highlight the reason why. So severe malaria. So yes, the patient had a missed abortion and was evacuated, and then they said subsequently later. So she were in a malaria hyperendemic zone, and then there's increased risk of malaria at all stages of pregnancy. So even the missed abortion could have been as a result of a placenta, as a result of parasitemia by the malaria parasite, and then following the instrumentation, she could the presentation of fever, even the thrombocytopenia, the renal impairment, all these can be manifestations of malaria, and actually severe malaria, considering the other laboratory parameters. So it is important to still consider this in this patient. Then other acute viral infections. Yes, especially looking at the laboratory parameters provided. So the white blood cell count was relatively at the lower end of normal with relative, relative lymphocytosis. So usually, this is usually the picture we see in acute viremias, and then with the fever. So it could be, the pregnancy state is still a state where the individual is at increased risk of contracting these viral infections, especially when we consider Lassa fever virus. Fine, we do not have information about the risks or contacts or in this patient, but with the presentation of the febrile illness and even the bleeding per vagina, it could still be related to her contracting these infections. And then she could have pyelonephritis or a urinary tract infection, which may actually be the disease entity and not necessarily the post-abortal sepsis. Also, the risk here being her having had an instrumentation for the evacuation of recent. And then it could actually be an acute presentation of pelvic inflammatory disease. Now, this is quite different from post-abortal sepsis in the sense that for post-abortal sepsis, the organisms implicated are usually polymicrobial, but we consider organisms like Staphylococcus, like group A Streptococcus, Clostridium, and gram-negative organisms related to these organisms being introduced during the instrumentation into the uterus. But for acute PID, it is usually caused by sexually transmitted infections that had been present before, but now presenting acutely because of the recent instrumentation into the uterus. So conditions like chlamydia. So it can be what is actually presenting acutely and not necessarily a post-abortal sepsis. Then considering her presentation of fever and anemia, thrombocytopenia with the renal impairment, we also have to consider the thrombotic microangiopathies, and then she's a young female of within the reproductive age group. So it could be a presentation of hemolytic uremic syndrome, even though we were not giving parameters to just suggest hemolysis, but in individuals that could have a background SLE, they can present with hemolytic uremic syndrome around the pregnancy period. And then the close counterpart is the thrombotic thrombocytopenic purpura, which is also a TMA, but usually this would also be accompanied with some neurologic manifestations, and in addition to the fever, the thrombocytopenia, the hemolysis, and the renal impairment. And then there's also a possibility of this being a gestational trophoblastic disease, even though usually this doesn't necessarily present with fever, but bleeding per vagina. So depending on the progression of the illness, usually this is seen when the patient has had either a miscarriage or an evacuation, or even depending on the trimester of the pregnancy, and then there's persistent vaginal bleeding after, despite possibly treating for infection or even evaluating for coagulopathy. So it may be the underlying cause. So these are possible things that could be considered in the evaluation of this patient. So the third question asks that we should list the teams that will be involved in her management with their roles. So considering this patient's presentation with severe sepsis, with some organ dysfunction, renal impairment, thrombocytopenia. So this patient is critically ill, and the main goal of management is to reduce morbidity and to prevent mortality. So she is likely going to require advanced supportive measures like mechanical ventilation, vasopressor support, hemofiltration. So she should be managed in a critical care setting, either an ICU or an high dependency unit. And the next team that should be involved in our management is the infectious disease team, which would provide guidance on the choice of empiric antibiotics prior to obtaining culture results, which would also be related on the epidemiology. They would have the facts about the prevailing organisms in the environment, and then to advise on the empiric coverage, and also advise on the appropriate sampling sites and techniques to obtain cultures. And also in the other differentials being considered, their review would also shed more light on other things that should be tested for this patient. Then, of course, the obstetrics and gynecology team has to be involved, because this patient primarily is had a recent uterine instrumentation. So the O&G team will be required to examine to be sure that she doesn't have retained products of conception, which is usually the focus of post-abortal sepsis. And also the bleeding per vagina may not necessarily be as a result of the sepsis. During the evacuation, she could have sustained some injury, cervical or vaginal laceration, or even uterine perforation. So the O&G team will be required to examine, and also for obtaining the cultures from the genital tract. And then depending on the progression of illness, she may actually need to be re-evacuated, re-explored, or may possibly need a hysterectomy depending on the progression of the illness. And then the next team that should be involved is the nephrology team. We're told that she had deranged EUCR. We don't know how severe it is, but it's important that they're involved in our management to optimize her renal function, and then provide expert management depending on whether it's fluid challenge or hemodialysis or some other renal replacement therapy, and also in guiding the choice of medications to avoid further worsening her renal function. And then also in possible a differential comorbidity if eventually she also has or it was pyelonephritis. Then the radiology team should be involved, because she's likely going to need frequent pelvic ultrasound assessments initially, especially in the bedside, as she's going to be managing critical care. So initially, this would need to be done to confirm if there are retained products, if even during the course of illness, depending on her response, if she's developing an abscess, there may also be need for more advanced imaging like abdominal CT. So the radiology team needs to be involved in our management. And then the clinical hematology team the told she has thrombocytopenia. One of the complications of severe sepsis is disseminated intravascular coagulopathy. So this may still present, and then they would be required to help to manage this. And also considering the other things we were considering, the thrombotic microangiopathies, she may, if that is the case, then she may need some advanced management like therapeutic plasma exchange. So this expertise will be provided by the clinical hematologist. And the pathology teams in the hospital would be involved. The microbiology will be required to facilitate the cultures and the results to be able to optimize our management, and also other testing to help exclude the other differentials as required for the viral Lassa fever, other viral infections, to guide on the testing for those and other necessary serologic tests in her management. And of course, the hematology team, depending on the evolution of the illness, she's presenting with severe anemia, so she would need blood products. She may also need some other constituents like FFP platelets, prothrombin complex concentrate, depending on her presentation and as the need arises. And then the infection control team may be required to be involved as the management progresses, and then with results, because if it turns out that it is Lassa fever, then they will need to put steps in place to provide barrier nursing to prevent the spread of the infection to other healthcare workers and then other patients, especially considering the critical care setting of management. And then the hospital pharmacy team would need to be collaborated with, depending on the culture results. Sometimes when patients have multi-drug resistant pathogens, the medications may not be readily accessible. So the hospital pharmacy will help in liaising to have access to those medications, and then other antimicrobials if it's antiviral. If the patient turns out to have a thrombotic
Can you round up in
microangiopathy,
2 minutes?
will need IVIG. And then lastly, the clinical psychology team. This is essential. It's usually omitted in care, but patients that have had to spend some amount of time in critical care setting may, after recovery, may have depression, some form of PTSD. So it's important to provide this intervention before discharge for the patient to be reviewed by the clinical psychology team to assess for and manage for post-critical care or post-ICU syndrome. So thank you for listening.
Okay, thank you, Dr. Temitope, for the lucid presentation. Okay, any comment, contribution from the participant? Comment and clarification from the participant, please.
Okay, good morning, everyone. Thank you so much, Dr. Temitope. Can we please go back to your differentials? Please, thank you. Okay, so why did you, okay, my issue is the arrangement. So I don't know, why is severe malaria the topmost? I was thinking maybe we'll put maybe sepsis complicated with DIC, or I don't know. So I don't know what you think about that, because I think severe malaria, and from my own angle, shouldn't be the topmost on your charts for differentials. So I don't know, please. Can you just please explain to me why severe malaria is first?
Okay, sorry, thank you for the question. So we have actually listed the diagnosis first. So the first question was, what is your diagnosis? Which I said my diagnosis was severe sepsis, likely post-abortal sepsis, complicated with severe anemia and acute kidney injury. So I've actually mentioned sepsis first. So then we're now asked to list differentials. So that's why I started with severe malaria. I felt that I should start with things that are more common in our environment that can also explain her presentation. Well, I felt I should start with the commonest disease entities before moving to the uncommon one.
Well, thank you. Well, but I think looking at when the question was asked, it's around May, and we are just exiting the LASA period. Usually it's towards the end of the May that we are exiting, that the cases maybe have started going down, and that was when they asked the question. I think the Lassa fever should have gone up, and then the DIC, things that can precipitate bleeding and renal failure should come first, because malaria, yes, can cause renal failure, can cause abortion, but should have been other things that can cause bleeding and renal failure first before other things. But by and large, I think it's okay. They may not paralyze you for the arrangement as long as you cover as many differentials as possible. Sorry, from the
Thank
chat
you.
box.
Dr. Becky wants to talk.
Okay, Dr. Becky, please go ahead.
Good morning, teachers and colleagues. Thank you very much, Dr. Timitupe, for the excellent presentation. Please, as regards the diagnosis, severe sepsis, I recall from the national update we had that using the term severe sepsis is no longer recommended. I don't know, maybe I would probably get clarification from colleagues here. And so could the diagnosis be rephrased as post-abortal sepsis with multi-organ dysfunction, one, the AKI, thrombocytopenia, and what's the other one you mentioned? Could we rephrase it as such? Thank you very much.
Okay, thank you very much for the question. Yes, I'm also aware of the recent, I think was it sepsis 3, where the term severe sepsis is being phased out. But I don't know if it's universally acceptable, because even for in arriving at the diagnosis of sepsis now, even though now they want us to use either SOFA or NEWS or BOT, I still saw that, in some authorities, they are still okay with using the SIRS with evidence of sepsis. So in terms of listing it as sepsis with multi-organ dysfunction, I thought about that, but usually the multi-organ dysfunction, there are some specific cutoffs for each of the organ dysfunctions. And for the AKI, they didn't really tell us the value. They just told us the EUCR was deranged. And for ARDS now, she just has the respiratory rate of 40 cycles per minute. They didn't even mention the blood pressure if she was hypotensive. So I wasn't sure if I had enough information to actually say this is a multi-organ dysfunction syndrome. That's why I just stuck with the severe sepsis, and then using the older criteria, where for severe sepsis, in the presence of sepsis, if there's any one of these ones present. So she had a platelet count less than 100. She had renal impairment. And so these don't have specific cutoffs, but once any one of them is present, then in the presence of sepsis, we can say severe sepsis.
Okay, thank you. Well, I think we shouldn't go into that discussion as using SRS, the criteria. I think even among the ID physician is something that so many people have different opinion. But since this is a general medicine, I think the examiners may not fault you by using the SIRS criteria superficially, but if it is ID, maybe I think they expect to go more details. So I think we are our time is fast spent. So let me quickly read from the chat box before our facilitators cap it all. The doctor, I think, is it Dr. Yahya? Most people were thanking you. Then Dr. Mwanta said, sorry, using the Q so far is more specific test to identify patients requiring critical care in foot or as risks of death. And the SIRS is more sensitive, which I think we mentioned those ones. Then he said also you need to discuss contraception with patient post-abortal sepsis care. Then Dr. Ekele say in the question they mentioned lymphocytosis instead of leukocytosis. Is there a catchy something with that? Yes, I don't know. Do you have a response to that? But I think we've discussed.
Okay, Chief. Well, it was just a way, well, to explain the other possible differentials in terms of the viremias. Actually, usually that is when you can have related to lymphocytosis. But even in severe malaria, what they really don't have, except for the malaria with sepsis, that's the algae malaria, they can just have lymphocytosis, anemia, thrombocytopenia, deranged UCR. So I wasn't sure if it was a catch. I mean, but we just have to put everything into perspective, both the history, the clinical parameters, and then the available lab. So I still felt it was sepsis, despite the WBC provided.
Okay, thank you. I think the catch there, the lymphocytosis, the bleeding, pregnancy, the weather or the climate condition may all is pointing towards the Lassa fever. It's viral in origin, and even the AKI, all those things, if you match them together, is pointing towards Lassa fever. But I think you must have gotten it because you discussed Lassa along the line. Thank you very much, the participant and the presenter. Sorry for our facilitators. Can you cap it up for us?
Thank you. Thank you. Thank you, Dr. Datu, for coordinating. Dr. Temitope, that was quite lucid. Thank you so much. I appreciate the questions, the contributions from the participants. Dr. Tanimo, congratulations. You're not a facilitator. Congratulations. Thank you for joining us, for coming back to class. Thank you. I think I've seen so many of your colleagues in class. Thank you. I appreciate your presence. So thank you so much.
Thank you very much, Ma. Thank you very much, Ma. I am very grateful for all your help. Thank you very much. Thank you very
Thank
much.
you. Thank you. Dr. Yahya, thank you. Thank you so much. Your
Thank you, ma.
presentation.
Thank you, ma.
Also
Thank
being
you.
our class rep. I appreciate your sacrifices. Our
Thank
other facilitators, Chief Cookie, Chief Chito, Chief Amigo, Chief Maza, Dr. Kopi, Dr. Fatima. I don't know if I missed anyone. Thank you all for your presence. Thank you. Dr. Okopi, Dr. Fatima, just a few comments and close the class.
Thank you very much.
Sorry, ma, the recording.
Presenters. Yes, you can stop the
Anything,
recording.